I wanted to talk to you today about choosing your care provider for your pregnancy. Now, if you're not pregnant yet, if you're still trying to conceive, if you're planning an upcoming IVF cycle, you're planning an IUI cycle, or you're just trying naturally, please save this video for when you find out you are pregnant, or continue with me now because I do think that the information and being empowered to feel like you can change your care provider if it's not the right person for you, whichever type of care we're talking about, is really important. So I want to give you a little bit of story about myself. So I had my first daughter in Dubai and through IVF, and I was handed over to my first obstetrician, I think around 13 or 14 weeks into her pregnancy. So for those first 13 or 14 weeks, I was under the care of the IVF specialist that we went through. So she took care of us until that point and then referred me on based on my preferences of who I said I'd wanted to be referred to. But it took me another 3 attempts of switching obstetricians until I found the right one for me. But that wasn't until I was 34 weeks pregnant. And it wasn't until sort of I was doing a hypnobirthing course when my hypnobirthing educator encouraged me that if, gave me some ideas around the right care providers in Dubai and that kind of thing, and then empowered me. And it got me thinking, actually, I don't know if I am with the person that's the best fit for my partner and for myself and what we were looking for. So we switched. And it wasn't until I was 34 weeks that I found the person that felt right for me. So I wanted to give you the permission and for you to feel empowered that it's totally fine to change your care provider. And again, whatever type of field we're talking about, until you find the person that feels like they're the best fit for you and vice versa. So let me touch on a couple of things more just for awareness rather than, this is definitely not to scare you, but around pregnancy care or after birth. Up to 1 in 3 women report or have postnatal depression, and that can sometimes become, 1 in 3 women talk about birth trauma. 1 in 3 talk about birth trauma. And a traumatic birth is not necessarily defined by fearing for you or your baby's life, although that could definitely lead to trauma. Birth trauma for women can be feeling a loss of a sense of control, or not feeling like they were heard, or feeling disrespected, or feeling alone, or feeling like things were taken out of control. And so, or they didn't get the permission before someone did something. So there's lots of reasons what can define someone calling their birth as traumatic. But I think it's really good for you to know that what I think is one of the biggest influences on you describing your pregnancy care as a really positive relationship, and you describing your birth and postpartum as a positive time in your life, can be largely influenced by the care provider that you choose and work with during your pregnancy, on your birthing day, and for your postpartum care as well. Now, just as a side note, that's just as important for me during your fertility as well. If you're working with a fertility specialist, I need to know that you're working with someone that's a good fit for you as well. It literally starts, the care providers that you're working with need to be the right fit for you when you're trying to conceive, when you're pregnant, at your birth, and through your postpartum, if you want to be able to look at that whole time as positive. And that's ultimately what I want for you. So a couple of questions that I've got for you that I want you to, or 3 questions that I've got for you that I want you to run through in your mind when you're thinking about either your upcoming pregnancy or your pregnancy right now, to help you ensure that you've got the care that you need so that you can look back and say that you had a really positive pregnancy experience all round. Okay, so the first question that I want you to think about is what, and get to know what kind of care options you have in your area and what kind of care you think you would like to have. So my first pregnancy appointment with my patients is generally between the 4 to 6 week mark. If we know someone's going through IVF, we would plan that based on, when their embryo, when they'll be doing their beta HCG. Or if someone's trying naturally, they let me know they're pregnant, and we plan for that first appointment in the first 1 to 2 weeks of them knowing they're pregnant. That is because I want to go over a heap of stuff that they need to be mindful of for them and their baby for their first trimester, so that they feel really healthy and they can enjoy that first trimester and without too much fear or anxiety or that kind of thing, and also feel physically well. But one of the other important discussions I have with them in that time is the care options, depending on where they are and what I know of their region, that they might like to think about for their pregnancy care. So there might be options for you to think about whether or not you think you'd like, and this is different at this particular time, but whether or not you want to have, depending on the care that you've got, some home birthing midwives are still doing their appointments at home, in your home, but whether you want your appointments and your checks at home, whether you want a medical, like a doctor, an obstetrician, to get that one person to care for you all the way through your pregnancy, and you want to continue with that person or have them at your birth, and for your postpartum care, whether or not you'd like to go with excuse me, with midwifery practice. And when within the different types of midwifery practice, especially here in Australia, you've got options to decide whether or not you want to have maybe, say, one or two or maybe three midwives that you know really well. They support you through your pregnancy. This is through our public system, and of those, one to two to three midwives would be there with you on your birthing day. You'd have a faster get out of hospital, faster discharge from the hospital, and then some care in your home afterwards, as opposed to some people who know their care is that they don't mind if they have a different midwife at each appointment through their pregnancy, but they know they want a longer stay in the hospital after the birth. Then that would be a different program to choose from. So get to know, ask your friends, ask me if we're working together, or somebody else, what maternity care options you have in your region, and figure out which care model you think might be a good fit for you. And idealistically, because of course this can change. Like I said, I didn't change my mind until I was 34 weeks. But you don't always have that option, of course, because some practices fill up. I was just lucky. So yeah, have a idealistically what you think would be your perfect fit, and then start meeting with those people to have discussions to see what you think. The second thing that I want you to think about is to get to know what type of birth you think you want. Now, I generally ask in that first appointment between 4 to 6 weeks, I say to someone, so tell me in the big picture, what do you think you'd like your birth to look like? And they often get a little bit shocked thinking that we'd even be having that conversation. But because in some places you do need to book in, if you're choosing, say, a private midwife or a home-based service, some of them you do want to book in around the 6 to 8 week mark, very early on in pregnancy. And so having thought about that very early on in your pregnancy gives you a chance to make sure, if that's what you need to do, that you can get into the clinic that you want. So I asked them, have you thought about the way you want your birth to look like? And then you need to, along with those questions that I ask about the way you want your care to look, think and ask and talk with me or whoever about how or who is most likely to help support you to have that type of birth. So your question is not just whether you have private or public health insurance, because that is often the way that someone determines which type of birth, which type of pregnancy care they go with. But I'd rather you think about, you choose the model that you think you might like, the type of birth that you might like, and make sure those two are in alignment with each other, because that's really important. And it can really impact your outcome at your birth if you have the care provider that or care providers that support you towards your goals. So yeah, that's a really important question. What type of birth do you think you want? And the third thing that I want you to think about for your care providers through your pregnancy is, who else do you want to invite into that team? Now, my model that I work with my mums with is a really holistic model. So they would have, say, primary care with their obstetrician or their midwife or GP, and then I'm a part of their team, and I provide the holistic pregnancy support, diet, supplements, meditation, relaxation, exercise, whatever, that holistic program. Treat natural medicines to treat symptoms if they have them. But my plan that I work with women is very scheduled. Like I follow a strict plan when I'll meet them and what I'm supporting them with at each of those appointments. So pregnancy wellness is what I offer my patients. And then I'll also often suggest that they work with, say, maybe a chiro or an osteo, and they invite them into the team of people with us as well. And maybe it's also a psychologist or a counsellor who specialises in perinatal counseling or psychology. If someone has anxiety or particularly around pregnancy, or just generally, or they have any type of depression or mental health issues that we need to support them with as well. You might think about making, finding the best pregnancy massage therapist that feels like they're a really good fit with you. Some women that I know, we look forward to their one pregnancy massage, and that's all they've decided to have. And they go on the day, and though they enjoyed the massage, the person wasn't the right fit, or something wasn't quite right, the ambience, the environment. So you need to investigate these things. Ultimately, have more than one pregnancy massage, but plan these things out in advance. Find out your area, in your area, who else there is. So it's not just, you might have a doctor or a midwife. You might have myself. You might have a chiro and osteo. You might have a psychologist or a counselor. You might have pregnancy masseuse. Who have I got else on my list? Pregnancy Pilates or yoga. So you might need to find these care providers to help support you on your pregnancy journey. So start thinking about your pregnancy care as a team of people that are going to support you. By the way, that's still the same for fertility as well. I think you want to have that full team of people around you as well. So there's three important areas, those three important questions that I want you to ask yourself is research and find out what type of care options you think you have around you and what might be a good fit for the type of pregnancy care that in the big picture you think you'd like. Does that align well with the type of birth that you'd like to work towards? And the third question is, who do you want in that team, that care provider team, so that you feel like you've got the most holistic support to support you and your baby as you work your way through your pregnancy? So that's all for me today, guys. I'm look forward to talking to you again soon. If you've got any questions and you're watching this as a replay, just pop it in the comments and I'll come back and talk to you. Bye.